नमस्ते। आज के इस वीडियो में हम ब्लीडिंग से रिलेटेड मेडिकल टर्मिनोलॉजी के बारे में जानेंगे। जनरल टर्म ब्लीडिंग, द लॉस ऑफ ब्लड फ्रॉम द सर्कुलेटरी सिस्टम, ब्लड लॉस, a broader term for any reduction in blood volume. Hemorrhage, excessive or profuse bleeding, either internal or external. Hemostasis, the process by which the body stops bleeding. Clotting, the process of forming a clot to stop bleeding. Coagulation, the process of blood clotting. Exsanguination, severe loss of blood to the point of death. Based on location, Epistaxis, bleeding from nose. Hematemesis, coughing up blood. Hematemesis, vomiting of blood. Hematuria, passage of fresh blood through the rectum. Melena, black tarry stool due to GI tract bleeding. Hematuria, blood in the urine. Hemothorax, presence of blood in the pleural cavity. Menstruation or menstrual cycle, normal vaginal bleeding occurs in every month. Menorrhagia, excessive menstrual bleeding. Metrorrhagia, abnormal bleeding between regular menstrual periods. Antepartum hemorrhage, vaginal bleeding after 24 weeks of gestation and before delivery. Postpartum hemorrhage, heavy bleeding after delivery. Intracranial hemorrhage, bleeding inside the skull. Subarachnoid hemorrhage, bleeding into the space between the brain and the thin tissues covering the brain. Subdural hematoma, collection of blood between the brain and its outermost covering. Petechiae, small pinpoint red or purple spots due to bleeding under the skin. Purpura, large purple spots due to bleeding under the skin, size 4 mm to 10 mm. Ecchymosis, large area of bleeding under the skin, size larger than 10 mm. Hematoma, localized collection of blood outside blood vessels. Based on cause or severity, arterial bleeding, bright red spurting blood due to artery damage. Venous bleeding, dark red steady flow due to vein damage. Capillary bleeding, slow oozing blood due to capillary damage. Traumatic bleeding, bleeding due to injury. Spontaneous bleeding, bleeding that occurs without a clear cause. Based on bleeding disorders, hemophilia, a genetic bleeding disorder where blood doesn't clot properly due to a deficiency in clotting factors. Von Willebrand disease, the most common inherited bleeding disorder caused by deficiency or abnormality in the von Willebrand factor protein, which is essential for blood clotting. Thrombocythemia, a condition where the blood has too many platelets, which can lead to bleeding. ये था आज का हमारा वीडियो। अगर आपको ऐसे ही और मेडिकल फील्ड से रिलेटेड वीडियोस देखने हैं तो हमने एंड स्क्रीन पे लगाए हुए हैं, आप जाके देख लीजिए। आज का वीडियो पसंद आया हो तो वीडियो को लाइक और चैनल को सब्सक्राइब कीजिए।